Good afternoon, everyone. Imagine this. You are 40 weeks pregnant, a long, grueling 40 weeks, at what you think is to be the finish line, but it turns out not to be. Your doctor informs you that you may need to be induced. You've read the books, you've packed your hospital bags, you've done everything you can to be prepared for a natural labor, never considering that you may need to be induced. Now, you are feeling fearful, uncertain, but today, I'm here to address those concerns, to share with you why there is no reason to be concerned, and explain that not only is an induction safe and effective, but in your situation, it may be the best choice for you and your baby. Today, I'm going to inform you why an induction is going to be the best decision moving forward, and I will be providing you evidence-based information from the American College of Obstetricians and Gynecologists, the World Health Association, the Centers for Disease and Control and Prevention, and the Mayo Clinic. This shows you that not only is it going to be backed by evidence, but it is also endorsed by medical providers and proven in outcomes. According to the American College of Obstetricians and Gynecologists, also known as ACOG, an induction is the use of medications or other methods to induce labor or begin labor. This approach occurs when continuing a pregnancy poses more risk to either mom or the baby than benefit. So why is an induction ever considered necessary? According to ACOG, going beyond 41 weeks pregnant poses additional risks to both mom and baby. These risks include placental aging, which begins around 39 weeks gestation, decreased oxygen supply to the baby, low amniotic fluid, and a higher risk in stillbirth. The National Library of Medicine even shares that the risk of stillbirth increases with gestational age from 2.1 per 10,000 ongoing pregnancies from 37 weeks of gestation up to 10.8 per 10,000 ongoing pregnancies at 42 weeks of gestation. The World Health Organization also supports this. Their recommendation is labor being induced if a woman reaches 41 weeks. WHO states that an induction can reduce complications for both the mother and the baby. Along with perinatal death, waiting for labor to come naturally may sound like the best idea and the most appealing idea, but in this case, waiting can be extremely dangerous for the baby and the mom. Now let's talk about the safety of inductions. Based on the ARRIVE trial, which is an extremely influential study in the OBGYN community, this study is on inductions versus spontaneous labor. This study was published by the New England Journal of Medicine, which followed over 6,000 healthy first-time mothers. This study found that elective inductions at 39 weeks reduced the need for a cesarean section, also known as a C-section, lowered the risk of hypertensive disorders in the mom, and did not increase any complications for the baby or the mother. For years, it was believed that inductions increased one's likelihood to receive a C-section, but according to this evidence, when timed right, it can actually lower the chances of getting one. In other words, an induction doesn't really increase complications. It can actually reduce them when done under proper medical guidance. The Mayo Clinic, which is a trusted name in global healthcare, also confirms that labor inductions are safe when done for medical reasons or at the recommended time, is often the best choice when there's concern about the baby or mother's well-being. An induction can begin in many ways. The most common practice include Pitocin, which is going to be a synthetic oxytocin, which is used to stimulate uterine contractions. Prostaglandins, which are medications used to soften and ripen the cervix. Or a balloon catheter, which can be used to begin dilating the cervix or making it expand. And then an artificial rupture of membranes to release amniotic fluid, which is typically used to stimulate labor. Each of these techniques mentioned are all evidence-based and only done under the supervision of a medical provider, such as a doctor or even a midwife. These techniques will gently guide your body into labor and eventually delivery. Some may ask if these methods may lead to stronger contractions than in spontaneous labor, and the answer is yes, along with labor potentially taking longer, but the benefits far outweigh the discomfort when compared to the risks of doing absolutely nothing. Finally, there are a multitude of medical reasons it is necessary to induce labor. According to the Cleveland Clinic, most medical indications for an induction include preeclampsia or gestational hypertension, gestational diabetes, low amniotic fluid, post-term pregnancy, which is being over 40 weeks, an infection of the uterus, and a baby that has stopped growing properly. The situations previously listed are all causes for one to be induced. An induction helps reduce the serious complications that can arise from these conditions. Some of these complications being emergency cesarean section, fetal distress, and even NICU admissions for the baby. Now, some may say, but I want my birth to be as natural as possible, which is a valid and more than admirable. But choosing an induction for the safety of you and your baby is the key to working with your provider. Or for you and your baby. The key is working with your provider to decide what is the best course of action for your health and not the fear or the pressure of this decision. In conclusion, this is why you should consider an induction at 39 weeks or if recommended by a medical provider. Going past 41 weeks raises the risk of stillbirth and other complications. Induction at 39 weeks can reduce the chance of a C-section. Medical inductions save lives, and it is a common and safe practice. An induction is not something you should ever dread. It is something that you should consider, understand, and use when absolutely needed. It is safe and evidence-based and a proactive decision. So if you find yourself in the position of being 40 weeks and your provider recommending induction or any other indication, just know that you aren't rushing or playing with time. You're protecting you and your family's future. This would end in saving your baby's life, protecting your own health, and giving yourself a peace of mind. And that is why you should consider having an induction. Thank you for your time.